Thank you very much, Pam. So, let's check this works. Good morning, everybody. Good morning. My name's Steph, and I'm from an organization called the Data Lab, and we are based in Scotland. We have an office here in Edinburgh, Aberdeen, and Glasgow. The Data Lab would like to thank Pam and the iCAN Summit team for inviting us to speak today. So today, what I'm going to do is talking about data saves lives. I'm going to give you a very high-level whistle-stop tour of how data can save lives. So, are you ready? I'm first in the day, so I'm going to try and keep it, interesting and bright, because I'm sure you guys are all, sleeping off last night. Hope you're having a good time in Edinburgh this week. So, let's go. Okay, I'm going to start with a meme. Toy Story, love Toy Story. Data everywhere. There is data everywhere. The world, with advances in technology, the world is getting more and more digital, and this produces in data loads and loads of data. Everything you do these days when you interact with some form of technology produces data. Just to give you some example, for example, Walmart, which everyone knows, they have a million customer transactions per hour. Just think about that, per hour. And that feeds into a database of many petabytes. Normally we deal in, kilobytes, megabytes, gigabytes. Petabytes is 1,000 million bytes. So that's a lot of data, and that's every hour. So just think about how much that is. Other things with lots of data, for example, our human genome, there's 3 billion base pairs in there containing huge amounts of data. So in terms of advances in technology, if you think about it, 10 years ago, when they first, just over 10 years ago, when they first sequenced the human genome, it cost $10 million and took them many years to do it. Now you can do it for just under $1,000. So that's the kind of rate of change in technology. So data is everywhere. Here's a quote from Tim Berners-Lee, who's the founder of the World Wide Web. I think it's just quite an important thing to frame what I'm trying to say. Data is a precious thing, and it lasts way longer than the systems themselves. So there's a lot you can do with data. So what can we do with this data? It can do a whole lot of things, but I'm here to talk about how data can save lives. So I'm going to give you some examples of how it can make a difference in healthcare. In Scotland, we have some of the best healthcare data in the world, from maternity data through to the actual birth, immunization, child health, GP consultations, prescribing, dental, A&E, outpatients, screenings, cancer registrations, mental health, right through to death. This data has the potential to revolutionize medicine and healthcare. So, example, including but not exhaustive list of things you can do. Healthcare service improvements. You can look at data to see where your healthcare service can be improved. For example, if you have particular processes, you can look at how these processes vary over the country and see which ones work the best, and then tweak things accordingly. You can enable shared decision-making. The more data people have and access to, and being able to see how their journey will track throughout their treatment, etc., they can make better shared decisions with their clinician. It can help clinical decision-making. Has anyone heard of IBM Watson? Yes, IBM, huge tech company. They have a brilliant tool called Watson, which is an AI platform. And one of the things it's trying to do is help clinicians make decisions. AI and machine learning, data science, can automate the process of absorbing information way faster than we as humans can. So Watson can read a whole lot more information than we as humans can. So a clinician can use Watson to help them reach a clinical decision, because a clinician will only obviously know from what their own experience is and what they have read. But Watson can help them expand that reach of knowledge. So that's an example. Watson's not quite there yet, but it's doing pretty well. It can also help realize precision medicine and stratified healthcare. I'm not sure if this has been mentioned at all this week, but precision medicine is a big thing these days. It's about getting the right treatment to the right people at the right time. It includes using people's genomic data and their own clinical history to target specific treatments and kind of make it more effective, because we're all different. What works for one person doesn't work for someone else. And so using data science can help that. And improve clinical trial recruitment. I think today you're going to hear a lot about clinical trial designs, etc. I myself can't tell you much about that, but I can tell you that data can help improve clinical trial recruitment. If clinical trials can automatically select the right participants at an earlier stage in their treatment plan, the trial could have more effect, and it will be a quicker process as well. There's also lots of obviously other cool things not related to healthcare that data can do. You know, data science, AI, machine learning, self-driving cars, predicting World Cup outcomes. Useless but fun, and wrong, actually. I believe everything's been wrong so far. Siri, Alexis, Google, all that is powered by data, data science, AI, machine learning. It's all kind of all-encompassing, you know, terms that are used together. The list goes on. Okay. Next. So, how can data do this? I'm not a data scientist, but I know a reasonable amount about data science. So I'm going to give you a quick overview of how data science can do some of these things I mentioned. I love these little, you know, graphics that you get everywhere, you know, particular jobs, what people think you do and what you really do. That's just one take on a data scientist. But essentially, a data scientist is a term that actually describes lots of disciplines that have been around for ages. People who used to be called, you know, it brings together statistics, mathematics, programming, analytics, lots of different disciplines, and now calls it data science. It's the new sexy word of the 21st century. And people who used to call themselves analysts now call themselves data scientists, because, you know, it sounds a lot cooler. But it's a very broad discipline and encompasses many things. And it can use many approaches. Here are some of them. Predictive analytics. That's a statistics-based kind of way of analyzing data. Machine learning, which is using algorithms to train on existing sets of data to then make predictions based on what it's been trained on. Visualizations is also part of data science, because there's no point in having lots of useful data that no one can understand when they look at it. And data visualizations is a very specialized field, and there's some people doing amazing things. I don't know if you've heard of something called Information is Beautiful. They come up with some incredible infographics showing you some really important things. Processing of structured and unstructured data. What that means is unstructured data is like handwritten notes, clinicians' notes, you know, when they kind of write on their hands, oh yeah, she's not feeling very well today, etc. And unstructured data is also images, medical imaging, etc. So you can use data science to process that and analyze it. Natural language processing is also another form of analyzing unstructured data. It's about essentially machine learning applied to language. It is kind of the holy grail in medicine at the moment. There's lots of people trying to do it. They're not quite there yet, but an example of this is your patient record. If people can apply NLP effectively to your patient record, it can gather your data and organize it in such a way that can be easily analyzed and also easily accessed for things such as picking you for appropriate clinical trials. So that's just an example of some of the things you can do in data science. Ooh, I'm now going to show you a video that may or may not work. Okay. So I'm going to just show you a video about how we can use patient data in research. This video was produced by the FAR Institute and also the CDMC up in North England. There's several of these videos out there at the moment. Another brilliant one from an organization called Understanding Patient Data. It's very England-centric, and I just thought, we're here in Scotland, so let's have something a bit more broad. So this is a brilliant video that'll give you an idea of the different ways you can use data. So let's hope this works. Ooh, no, that did not work. Okay, I think there should be sound. Oh. Let me just pause it while you figure out.
Universities and researchers has a positive effect on health and social care across the UK.
I've been meaning to ask, what do people mean when they say patient data?
The NHS sees hundreds of thousands of patients every day, and each time, data is recorded, stored digitally, and used to provide you with care based on your medical history. But your data can also be reused in medical research.
So who actually does the research?
Universities and researchers are able to bring together information from all over the NHS and other sources too, and use it to create a better overall picture of health. Often, research done by universities involves NHS doctors. They provide the medical expertise, but work with academics and researchers to help them design meaningful studies and analyse extremely large amounts of data.
Why do they need to use my data?
Because everyone is different, looking at individual patients makes it very difficult to know why some people get sick while others don't. But when we look at the information from everyone in a city, or even a country, patterns emerge that can help us understand what's going on. It isn't new. For decades, patient data has been used to discover big health improvements that wouldn't be possible otherwise. For example, understanding that cycling to work can help reduce the risk of heart disease and cancer, or improving our understanding of how asthma develops in children. By analysing the ways that health services are used, researchers are using data to create modern and efficient services that are a better fit for the people that use them, making sure that all patients get the right treatment in the right place at the right time.
Who is my data being shared with? Is it safe?
Researchers accessing patient data need relevant training, qualifications and security authorisations. They must prove that the data will be handled in the safest and securest way possible and only ever used to improve human health. Before university researchers can access patient data, name, date of birth and address are removed. Researchers are only ever given the minimum amount of information they need to do their work. The good news is, patient data is already safely and securely used by UK universities to inform healthcare policy, create new treatments, and extend the lives of mothers, fathers, friends and children all over the UK. If you want to know more about your patient data, search the hashtag #DataSavesLives.
So there we go. I hope that was interesting. That explained a lot of things better than I could. So that's an introduction to Data Saves Lives. And I'll move on to, if I can move on. No, I cannot move on. There we go. I've taken this quote from an article that was only released last month from the Chief Clinical Information Officer for Health and Care. I'm going to read it out because I think it's really quite important. When we are at our most vulnerable, health and care professionals having access to our records allows them to understand our needs and make the best decisions with us and for us. Data quite literally saves lives. So I hope that video kind of gave you a brief idea of how that can happen. So now I'm going to give you some examples of things where data saves lives. So I manage a project called the Cancer Innovation Challenge. The Cancer Innovation Challenge is a £1 million project funded by the Scottish Funding Council, and it brings together innovation centres in Scotland and various partners, including the NHS, the University of Edinburgh, University of Stirling, and the NSS, which is National Services Scotland, to improve cancer care and outcomes in Scotland using data innovation. So we have two key work streams in our project. One of them is to use innovative data science to improve cancer care and outcomes. So applying innovative data science to current data assets in Scotland to improve cancer care. The other work stream is about using, collecting and integrating patient-reported data into someone's cancer journey. So data report, should you have cancer, it is taking into account your reported data into your care. Sorry, excuse me. So I'm just going to talk a little bit about the projects that we have going. So the first work stream about putting the patient in control and factoring their data into their cancer journey. So we initially funded 5 companies to take a feasibility study. Companies include Open Brolly Health, Docabo, and SiteKit. They're based all over the UK. Some of you might have heard of them here. SiteKit specifically had a solution for teenagers and young adults with cancer. But the 2 projects that we are now funding in phase 2 that have gone on is My Clinical Outcomes and PX Healthcare's OWISE solution. Essentially, these 2 solutions allow patients to report their outcomes and integrate it into their clinical care path. So once on point of diagnosis, you're recommended to use an app. My Clinical Outcomes is a web app. OWISE is a mobile app. And your clinician will introduce you to these apps. You register for it. You are in control of your data. Your clinician can then send you PROMS questionnaires. PROMS and PREMS is the term that's used in healthcare. It's patient-reported outcome measures and patient-reported experience measures. So there's currently a lot of these are done by paper, which is obviously, a bit cumbersome in this day and age. And also, lots of people live quite far away from their clinicians. These kind of tools, digital tools, will allow people to report how they're doing and responding to their treatments and how they're feeling on a day-to-day basis, and provide real-time access for their clinicians from the comfort of their homes. This helps improve, it has been proved in a paper recently, that improves survival by up to 5 months. A study was released earlier this year from the Ethan Bash group in the States. They do a lot of work on PROMS. So essentially, patient quality of life data needs to be standardized and gathered on a massive scale, so that whole pathways of care in every disease can be guided by what has actually helped patients live fulfilled lives. As we said, people are different, people respond differently, and this is a brilliant way of clinicians and researchers to find out how people are responding. There's many applications to this, as well as actually the patient's own care. It could help pharmaceutical companies determine how people are responding to specific drugs. I mentioned earlier, some people, especially up in the Highlands and Islands of Scotland, live very far from their clinicians and their clinical team. This way, they can let their clinician know how they're doing on a real-time basis. How many of you guys have felt rubbish one day, booked an appointment for a doctor, by the time you get to the doctor, you're fine? And that happens with cancer patients, and any patients, of course. There's usually a period of weeks, possibly months between appointments. How you're feeling at any particular time during that period is not something you would remember to tell your clinician, because usually you would tell your clinician how you're feeling at the point of your appointment. And the clinician can only act on that because they're not getting the full picture of how you're doing. So if you're sent away with a particular drug and you're on it for 3 weeks, and by the time you visit your doctor at your next appointment, you could be feeling great, but actually the week before you were feeling awful. You were sick, you could barely leave the house. This type of technology, which is nothing new, by the way, that you can get PROMS and patient data apps everywhere. What's key about this particular project we're doing is that it's integrated into their care pathways. So it's integrated into their electronic patient record. So a clinician doesn't have to do something separate to access this. It's all part of their patient record. So let's see, how am I doing for time? I shall move on a wee bit. Okay. And our other funding call was about using innovative data science to improve cancer care and outcomes. This is a little less, this is a bit more abstract. At the end of the day, a lot of it is about algorithms, which are essentially, mathematical formulas for following a rule, a set of rules. But we funded 3 companies to undertake a feasibility study. We had a company called JX and a company called Sharp Analytics. JX was doing primarily a data engineering project with data science applied to people with hematological cancers. Sharp Analytics have developed a tool which predicts your outcome, i.e. on point of diagnosis of metastatic cancers. It uses machine learning, analyzing vast sets of data to predict how long you have left, because that question is something patients always want to know, and clinicians will freely admit it's very difficult for them to tell you. So what they were researching is whether you could use machine learning to make this prognosis better. And then the third project we funded is with Canon Medical Research. What they're doing is using deep learning and machine learning to automatically read CAT scans imagery for mesothelioma. I don't know if you're familiar, mesothelioma is a rare cancer of the lung. It's known as the asbestos cancer. It is notoriously difficult to do RECIST scoring, which is a methodology of determining if patients are responding to a treatment. It requires a lot of resources to do it. What Canon are trying to do is automate the process. They've gone for the hardest possible cancer because their theory is if we can crack the hardest thing, everything else will follow. So that's some of the work we're doing in the Cancer Innovation Challenge. So the work we're doing in the data lab. The data lab, we work across all sectors, but we do work a lot in healthcare in addition to the Cancer Challenge. So just a quick example of some of the projects. We're working with the Beatson Cancer Charity and University of Strathclyde and NHS Glasgow for imaging using data science to delineate between healthy and cancerous tissues in head and throat, head and neck cancers. That's a very difficult thing to do because, as you can see, it's quite difficult to do for radiographers. So what they're trying to do is use data science to make that process more accurate and more automated. Another project we're doing with these partners here, Spiritus Partners, they're a blockchain company. I don't know if you've heard of blockchain. It's the powering technology behind Bitcoin. It's essentially a way of having distributed registries, so all the data is not held in one place. And they're working with ISD and NHS to use blockchain to track medical devices through their lifetime of use in hospitals. Another project we did is, once again, with NHS and the Scottish Government, which is delayed discharge. I don't know if you've heard of the term delayed discharge. Bed blocking, so people who are ready to be discharged, but the subsequent care arrangements aren't ready, so therefore they have to stay in hospital and, in a way, block beds. That costs the NHS millions every year. And essentially the project we worked with them is looking at data to see if we can use data to predict on point of admission whether a patient is at risk of delayed discharge. And if they are, the arrangements for their follow-on care are made earlier to avoid that. And then lastly, a project I will tell you a bit more about because I have a lovely video to show you again. Not entirely data saves lives, but data enables lives. Data Lab has worked with a project with Alban Housing. Alban Housing are a social housing organization up in the Highlands and Islands. They have built a series of fit homes, essentially houses that are filled with sensors everywhere. And the project we have worked with them is FitSense, which is analyzing the data that you get from those sensors. Essentially, the point of these homes is to help vulnerable people live independently for longer. And so here's a video to tell you a bit more about the Fit Homes project. And once again, let's see if this works.
Alban Housing is a social landlord that works across Highland, has over 3,500 properties. The Fit House aims to make people feel safe within their homes using technology that is ambient, so it's not obtrusive. It works with the people, it's their choice, and enables them to stay until end of life or as long as they feel safe to do that.
The fundamentals of how we want to develop data with this project is through creating a business which has social purpose, and so having that social purpose at the core of what we do keeps the whole process honest and keeps it that centre check of where it's at.
Increasingly companies are collecting data, and increasingly they will collect data for a purpose. At the moment they are perhaps seeing what data they have and finding uses for it. But this project, I guess, is very much designing the data into the project. We decided what sensors would be valuable, where they would be located, and we are breaking ground, I guess, in having data being collected in people's homes, being collected then centrally in order to be analysed.
We are taking people's data from the house, their movements, how they live their day-to-day life, and we are starting to be able to predict who's likely to have a fall before they have a fall.
In Scotland then we have a fairly small population, a fairly large area, and so things can be trialled here that will be rolled out much more generally across the UK, Europe and globally.
The fact that we are demonstrating solutions that can work in Highland then becomes the perfect platform for solutions for anywhere.
Scotland is at the cutting edge of technical development in AI and data globally. It's been proven in this project. Data is freedom. Data enables you to do and be and live in ways that you couldn't do previously.
So that video was created for our week-long Festival of Data Innovation in March. Slightly related to that particular project, there's also a project in Liverpool that's using smart meter data, you know, the smart meters you get for your electricity and your gas, to analyze that to see, to help monitor people living independently with dementia. We are creatures of habit, humans, so for example, if Mr. Smith boils a kettle every day at 5 o'clock for a cup of tea, and one day the smart meter indicates that he hasn't done that, that would alert the people monitoring his data, and they could go see if he's okay. So there's a lot of cool stuff going on. Okay, and once again, trying to get the slide to work. Okay. And also, just for your information, obviously not going to go through all this, it's 100 ways of how data can make lives better, but this is a series of 100 case studies of how data has saved and improved lives, specifically related to healthcare. I highly recommend you go have a look at it. So, running out of time, I will start to finish. Okay, it looks amazing, everything, doesn't it? It just looks incredible. It's of course not all rosy. You know, I can't stand here and talk about how wonderful data is without acknowledging some of the, you know, less positive sides. You know, you get data breaches by hackers. Everyone hears about that in the news. Data can be used to manipulate elections. You know, Facebook, Cambridge Analytica, that happened a week before our Data Fest, so that was what everyone was talking about, whereas we tried to spend the whole week talking about how data can do good. So unauthorized access to data, and then incidents such as Fitbit accidentally revealing locations of secret military bases from, you know, the soldiers going jogging. So, you know, data is this amazing power we can harness, but I don't think we're quite there with exactly how we can make sure that it's used for 100% good yet, but we're getting there. The promise of data-driven technologies will only be realized if the public have confidence in how they are developed and used, and both for delivering, you know, care and for research. So, you know, challenges include data security, like I mentioned, patient-public trust, because what you hear about are the data breaches. You don't hear about, the project that, did something amazing for a group of people with some data. You hear about when NHS, has a data breach, and then that's what travels and that's what makes news. So have to, there's an issue with patient and public trust in terms of use of data. Culture change. Also, it's about organizations and people and governments realizing the potential of data and how it can be used to make things better. It's a political and organizational culture change. Skills shortage as well. At the moment, data scientist is the hot, profession of the moment, but there aren't enough people out there, data scientists. Edinburgh and the southeast Scotland region are currently finalizing a city deal that posits this region as the kind of center for data-driven innovation in Europe. It has a huge mission to train, over 100,000 people to be skilled in data science. So, but currently we don't have that many. Solutions, transparency. Always be transparent with how data is used. Since the incoming of the GDPR regulations on the 25th of May, you would have all, well, maybe you might not have, since maybe a lot of you aren't actually based in the UK, but everyone in the UK and Europe would have received hundreds of emails from organizations they are signed up to saying, we've changed our privacy policy, please stay with us. So this is a way that makes sure you know what's being done with your data. Ethics needs to be considered in everything you do, research-wise, or just everything, I think. Communication, people using data need to make sure they communicate with citizens, with patients, with any relevant stakeholders. And there needs to be a willingness to change as well. It's, for example, my parents-in-law, refuses to have a dishwasher. At Christmas, we, spent hours doing the washing up when you could just stick it on in the dishwasher. That's they don't have a willingness to change. But I think, we all need to be more open to the benefits of advancing technology. And then, capacity building. We're all trying to train up lots of data scientists, especially here in Scotland. In Data Lab Scotland, we fund a lot of MSCs. Last year, we had a cohort of 130 MSCs in data science, which we funded. So if any of you are at the age of wanting to apply for masters, I think the next cohort will begin in September. We have 155 funded places for masters in data science related disciplines. So feel free to apply and come to Scotland, because I'm sure you love it after this week. And so that's just some challenges, some solutions, obviously not all encompassing, but just to make you aware that there are challenges. So that's kind of pretty much me. But I have one last thing, not quite healthcare related, but I think it's really important that I tell everyone about this. This is a book that I think everyone should read. It is the best thing you'll read this year, possibly the best thing you'll read ever. It's not fiction, sorry. It's not a good story, but it is just a brilliant book which talks about the importance of looking at data. And amongst all the craziness in the world today, reading this will make you see things more clearly and understand that the world really isn't as bad as you think. And data saves lives. Thank you.